The context of this study is antibiotic resistance. We really need to know more about the adverse effects of antibiotics, which are poorly quantified in the literature, to enable better decisions about the use of them. The way we approached this study was to find and identify any randomized controlled trial that used amoxicillin plus or minus clavulanic acid for any indication. And we found 730 such potential studies, of which 45 were eligible. 27 of them used amoxicillin alone, and 17 used amoxicillin plus clavulanic acid. One used both. 25 of them only, that's 25 out of 45, actually mentioned and recorded adverse effects. And we think that there was some underreporting because some did not mention adverse effects in their protocols. Even those that did record adverse effects did not do so systematically in every case, and we worry that there's probably an underreporting of adverse effects which may be affecting these results somewhat. What did we find? Out of the range of different adverse effects that we know about, 2 were statistically significant. One was diarrhea, which was significant only for amoxicillin with clavulanic acid. Amoxicillin on its own didn't have an increased risk of diarrhea. The amount of increased risk was an odds ratio of 3.3, which translates to a number needed to harm of 10. That means that for every 10 prescriptions there'd be an extra case of diarrhea in the patient treated. Similarly, for Candida, there was no difference between amoxicillin with or without clavulanic acid, and the odds ratio here was 7.8, which translates to a number needed to harm of 27, meaning out of every 27 prescriptions of amoxicillin with or without clavulanic acid, there would be an extra case of Candida. What can we do with these results? Well, they will help clinicians, I think, in shared decision making with patients to help balance the benefits together with the harms for the use of antibiotics, and hopefully there will be a reduced number of antibiotics prescribed consequently.